Hello and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and MC here at Gold. And today I have a special guest with me, Dr. Anya Kleinman. Welcome, Anya.
Hi, thank you so much for inviting me to join you.
It's wonderful to have you here. You are, of course, one of our speakers here for the add-on lecture pack for our Gold Midwifery Conference, and we'll get started with that in February. And the lecture pack that is our add-on this year is Comprehensive Care for 6 Newborn Challenges. I'm very excited about it. You take part in this, and your presentation is titled, How Low is Too Low? Managing Newborn Hypoglycemia. And I'm so excited about the topic. I have a couple of questions for you. But before we get into that, first of all, where in the world are you?
Thanks so much. I live in Northeast Ohio.
So do you see some winter weather already there?
Oh yeah, no, if you look out my windows, there's a layer of snow. And
Layers.
for those of you internationally who maybe don't know where Ohio is, so Ohio is right on the Great Lakes, so just south of the Canadian border.
Wonderful. Well, thank you for sharing that. Yes, we have an international conference, and I find it always fascinating where our presenters are from. You know, it makes the world so small, and we feel like all being part of a community learning together. I just absolutely love it. So let's talk about your background. You are, to me, the best of both worlds. You're a pediatrician and IBCLC. So you marry those two things together, which I absolutely love, and I wish more pediatricians would have that kind of background. So tell us a little bit about how that happened and about your professional journey.
Oh, thank you so much. I completely agree with you. I wish there would be more pediatricians or IBCLCs. I think there's such a value to people caring for babies with a knowledge of pediatrics, but also the expertise of breastfeeding medicine and IBCLC. So I actually learned by mistake that I could know more about breastfeeding medicine. So my oldest son was born when I was a third-year resident, and it made me realize just how much I didn't know about breastfeeding and how many opportunities there were for knowledge and empowerment of moms who are interested in breastfeeding and how important that could be. And just to supplement the pediatrics knowledge with lactation and breastfeeding expertise and how important that can be in the conversations we have. And I work in the pediatric emergency room, which might seem like a weird place to use breastfeeding medicine, but I actually find that so many young babies find their way to the emergency room when they're acutely sick, and so many conversations that happen need to involve the intentions of parents about breastfeeding.
Right. Right, absolutely. And I'm so glad you brought that up because, yeah, you work in the emergency room, but number one, breastfeeding can't just stop because there is like an emergency going on, right? The baby needs to be fed. And plus, often the nurturing of like, let's say if a procedure needs to be done or something needs to be done, the warmth of the baby being held, skin to skin and being nurtured and breastfeeding, that needs to be definitely be supported, right?
For sure. And of course, and there's so many situations in which the baby is sick, but knowing how to support the breastfeeding part of things is also really important because that's the intention for months and months for the parent. The baby's not going to be sick necessarily for that long.
Hmm. And what nutrition is better than breast milk, right? I mean, there is no better nutrition for a little one like that, so than human milk. So yeah, absolutely. Well, this is wonderful. And yeah, as I said, I wish more pediatricians would have that background and really strongly support the breastfeeding diet and the whole family for that. Now, your topic is hypoglycemia, and the title again is How Low is Too Low? Managing Newborn Hypoglycemia. And that's always something, there is a lot of controversy about it and lots of discussion about it. What is too low? What isn't? Do we need to step in sooner? We all have seen that jittery baby, and then, many caretakers are immediately jumping in. We need to give formula. We need to do this. We need to do all these different things, right? So, why is this also not so cut and dry? Why is this so complex?
Thank you for the question. That's so interesting. Yeah, it is. It's such an interesting thing knowing when just the right amount of intervention is so critical
Mhm.
and having the knowledge and the understanding of the research and the things that we do know and the things that we don't know can really drive the right amount of intervention so that we're not inserting ourselves in a situation or disrupting a process that actually would have resolved on its own, and so that we're not creating stress when there doesn't need to be, but also on the other hand that we're appropriately addressing situations that are really high stakes, and taking
Mhm.
best care of babies when they need emergency or acute care.
And also that breastfeeding is not interrupted or doesn't even, or starts too late. We've seen the situation where we see a newborn and it's being immediately rushed off. So there is no contact and it's been given formula. And I feel like there is some kind of a disconnect, right? Can you talk to this a little bit?
For sure, and I think sometimes, and we have to take responsibility as physicians too for that situation, right? So when we amp the situation up and we say we have to do IV fluids right now or 2 minutes ago or whatever it might be, it's really important to be thoughtful about the situations in which that happens, and the way that we communicate that and the support that we create around the mother and baby so that they are able to meet their own goals for breastfeeding. So even if we
Mhm.
are doing the things that need to keep the baby safe, making sure that we're not disempowering or stressing the mother out unnecessarily in ways that will break her future plans or make breastfeeding more difficult in the past. So it's not a this and not that. It's a how do we keep the baby safe, but also at the same time empower the mother to do the things that will help her sustain her breastfeeding.
Right. Absolutely. And you're also a strong proponent for preventative care or preventative management and looking ahead. I know you will be talking probably also in your presentation. I had a little sneak peek for the audience, so just so they know about like, if let's say we have a diabetic mother or we suspect that there's something maybe going on, that we can do certain things beforehand, before even going into labor, right?
Yeah, for sure. So, we have the power of knowledge. We can anticipate when there are babies that are more likely to have low blood sugars because we have data to suggest which populations of children are most likely to have low blood sugars. And so we can put control over the situation to some extent into the hands of the parents and anticipate that, and encourage them to express colostrum or to encourage them to hand express, because those are all really empowering, really positive things that parents can do so that if they need to, they have those things ready to treat the hypoglycemia, and they feel
Hmm.
that they have some degree of engagement with the process.
Hmm. What is your view on education, educating the parents? Do you see what do you see in your field? Do you feel like care providers need to do a better job educating about possibility, what could happen, or that hypoglycemia might even be an issue? I feel like is this even addressed enough?
I think you raise a really interesting point. I think it is really important that in situations where we can anticipate that certain problems will arise, we prepare parents for the possibility of those things, and so that they understand what would happen in certain situations. At the same time, I think it's also really important that we balance that with the understanding that most babies are pretty good at regulating their blood sugars. And in
Hmm.
the first couple of hours, it's really normal for babies to have blood sugars that are lower than they will be in the future. And so that we don't contribute to undue stress, but that we educate families about the process, and we walk with them through what's going to happen so that we're not just rushing in and grabbing babies and running, but we're really supporting the families throughout the process and continuing to describe next steps should there be some.
Yeah, that's a very good point. That's a very good point. Yes, preparing them, but also remembering that babies are very good in regulating and trusting also the process, but stepping in when we need to, but in a respectful way. That's very well said. Now, speaking of the little ones, we know we've seen the jittery baby, but what if the ones that don't show symptoms? How often do we see this even?
That's a good question. So I would say the majority of babies that we know have damage from low blood sugars show us signs that they're having low blood sugars, in addition to the fact it's not an incidental hypoglycemia, but it's a symptomatic hypoglycemia. And I
Mhm.
think it's really important for us to distinguish, and this is a distinction that exists in the protocols for management of hypoglycemia, between those infants that have low blood sugars and are manifesting signs and
Yeah.
symptoms and those that are not.
Well, thank you for that. Well, Anya, I feel like I could talk with you for hours here on the topic. It's so fascinating. There's so much to discuss, but we, of course, want our viewers to attend your presentation. So before I let you go, what are you hoping that the viewers will take away from your presentation?
Thanks. I'm hoping that The presentation will shed light on the situations that are most stressful and highest stakes, and also expose people to the things they can do in advance to anticipate those hypoglycemic episodes in high risk infants, but also to understand why it's important not to be too aggressive in managing hypoglycemia and what the downsides of that can be as well.
Mm. Well, thank you so very much, Dr. Anya Kleinman, for sitting here talking with me about the wonderful work you're doing and, of course, the presentation here at Gold.
Thank you. Thank you for inviting me to join this lecture series.
And for our viewers now, if you are curious now and want to learn more and want to check out this presentation on hypoglycemia and all the other presentations in the lecture pack titled Comprehensive Care for 6 Newborn Challenges, we invite you to go to goldmidwifery.com for more information. This is the add-on package for the conference. The conference will be live in February, and you will find out all the information about all the presentations in the conference there as well. And we hope to see everyone at the conference. Thank you, everyone, for watching, and have a lovely rest of your day. Bye-bye, everyone.